I'm sorry for the delay. Menstrual patterns and disorders among secondary school adolescents in Egypt, a cross-sectional survey. This survey was carried out in Giza. It's one of the governors in Egypt. It has 6 million inhabitants, and we did it in public schools. Next, please. Those are the people who shared in the study. Next. 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 To our knowledge, no large population-based studies have been performed on the topic of menstrual pattern among Egyptian adolescents in recent years. The aim of the study is to identify menstrual patterns and associated disorders, as well as the sources of menstrual health knowledge among Egyptian adolescents. Next. Nearly 1 in 4 Egyptians is an adolescent aging 10 to 19. Actually, we are a young country. Young adults as a whole make up about 1/3 of the population, just over 20 million persons. Roughly half of these are females. Yeah. Menstrual disorders among adolescent girls are common due to relative immaturity of the hypothalamic pituitary ovarian axis. However, the exact incidence is unknown, since teenagers do not present due to embarrassment as well as lack of knowledge about what is normal. Even though serious gynecological pathology is rare in this age group, menstrual problems can be symptoms of certain conditions like polycystic ovarian syndrome and endometriosis, which, if undiagnosed and untreated, may have profound long-term sequelae in adult life. Next. A cross-sectional survey, a total of 800 questionnaires were administered to post-menarcheal Egyptian adolescents attending secondary school in Giza, Egypt, from September 2012 to December 2013. Participants were asked to respond a semi-structured questionnaire on menstrual health awareness. The questionnaire included items on girls' socio-demographic and menstrual pattern characteristics concerning their age at menarche, menstrual cycle length, regularity, duration, and amount of flow, type and severity of pain related to menstruation, need for analgesia, and symptoms suggestive of premenstrual syndrome. Next. Our main outcome where initially girls were asked about the understanding of the function of menstruation and whether they perceived the menstruation to be normal or abnormal. That was actually the most important thing, because many of the girls did not perceive any symptom happening to them as abnormal. They think that that's their nature, and that's what we wanted to change. The second outcome was the description of menstrual pattern and disorders. Thirdly, the source of knowledge regarding menstrual health, menstrual hygiene, entitlement, dosage, and effectiveness, and sources of treatment received if required. Next. This cross-sectional study was carried out in Giza city, the 3rd largest city in Egypt, and it is located on the west bank of the Nile, with female primary and secondary school students enrolled in public schools. All girls who had already experienced the first menstruation were invited to participate. 412 out of 800 adolescents completed the questionnaire. The mean age of the girls was 14 years, with a range of 11 to 19. Mean age of menarche was 12, with a range of 8 to 16 years. The median body mass index for the population was 26 kilograms per meter square. Most of the respondents were urban residents. Next. 382 respondents reported various menstrual disorders, giving a prevalence rate of 95%. Regular menses in 66% of girls, cycle length ranging from 21 to 35 days. Mean 27 days for 57% of the cases. The mean duration of menstruation was 5 days, with a range of 2 to 8 43% of girls reported changing pads twice a day, while 38% 3 times and 17% 4 times. Dysmenorrhea was the most prevalent menstrual disorder in our sample, followed by PMS and abnormal cycle length. 16% of the participants reported spotting in between periods, and 9% reported blood clots with menstrual bleeding. That was actually strange because even those who reported blood clots did not refer to their cycle as abnormal. So that's the knowledge we wanted to change. We want them to have more knowledge about what's normal and what's abnormal so that they could seek medical advice and not to be shy to tell or to go to a gynecologist at this age. Fatigue, mastalgia, and mood disturbances before or during a period were the most frequently reported PMS symptom in our population, 68, 56, and 55 respectively. Menstrual disorders interfered with social and academic life of 33 and 7% of respondents, respectively. The mean duration of school absence was 1.5 days. Dysmenorrhea was responsible for the highest rate of school absence, 61%, followed by PMS, 38%. The majority of absence were for 1 day, with 32% for up to 2 days, and 3 girls reported missing up to 4 days of school each cycle. Most participants lacked menstrual health knowledge, and only 8.9% of girls reporting consulting a physician. 368 girls declined participation, giving a response rate of 51%. This response is considerably low. The refusal to participate is related to cultural taboos that menstruation must be hidden and should not be discussed in public. However, this result is not surprising because beliefs about menstruation are usually quite negative in many cultures. Mothers and health education should encourage girls to feel more comfortable with their bodies, teaching them to view menstruation as a maturational event rather than a hygienic crisis, and to reject shameful views regarding a biological female process. This study sought to provide information on the typical menstrual pattern among Egyptian adolescent school girls. The mean age of menarche was 12, mean duration of menstrual flow was 5 days, mean frequency of menstruation was 27 days. When compared with those from some European and American series and with other data from African countries, Egyptian girls have one of the earliest recorded means of all population studies. This could be attributed to the high body mass index of the girls in the sample population. However, because of paucity of local data, we were unable to comment on trends of age and menarche. Abnormal cycle length occurred in 43% of our respondents, which is higher than that by other studies. Adolescents have a greater degree of variability in terms of length of intermenstrual duration due to immaturity of the hypothalamo-pituitary ovarian axis, which can take up to 2 years to mature, with increasing frequency and amplitude of pulsatile gonadotropin-releasing hormone release. The high rate of cycle length abnormalities reported can be explained in part by the mean age of our respondents, 14 years. Nevertheless, in cases where abnormal bleeding has occurred greater than 2 years from menarche, other diagnoses must be considered, such as PCO, eating disorders, bleeding disorders, ovarian tumors, and thyroid dysfunction. Approximately 1/3 of our respondents reported additional symptoms. Although these were not verified by direct interviewing, examination, or investigation, they're important issues to be appropriately managed. Of interest is the high rate of adolescents reporting androgen excess signs, which in presence of infrequent cycles could be a sign of polycystic ovarian disease. Failure to address these early physical concerns and their reproductive implications can have profound lifelong consequences. Next. 85% of the girls perceive their cycle as being normal in spite of the high prevalence of menstrual disorders reported. When asked about source and function of menstruation, approximately 9% of the respondents answered correctly, with the majority stating that it has a cleansing effect. Statements shaped by the largely negative cultural beliefs. Neither maternal level of education nor residence study participants affected the level of knowledge about menstruation. These findings demonstrate that many teens lack the information necessary to recognize their symptoms as medical disorders that can be treated. Next. None of the girls in our sample reported school education as a source of menstrual health knowledge. This highlights the need to revise the school curriculum, as the current educational practices often present girls with primary biological information, lacking more practical information about the many variables that affect menstruation and different coping strategies. This connection between knowledge and a girl's own body experience occurs when education focuses only on the biological and hygienic aspects of menstruation. Another significant finding of this study is that only 0.7% of adolescents reported receiving information regarding menstruation from a healthcare professional. As a result, adolescent girls in our study are missing the opportunity to receive health education about menstrual problems as well as their diagnosis and treatment. Development of health assessment forms with standardized menstrual history questions may serve as a reminder for healthcare providers to discuss menstruation with adolescents. Alarmingly, while effective treatment for menstrual disorders exists, approximately 2/3 of all respondents were self-medicated. 1/4 reported low effective analgesic use, and only 7% consulted their healthcare provider. This later figure is of significant concern because if these disorders are considered to be normal and ignored, teenagers may not seek care for underlying gynecological conditions. Additional studies are needed to increase our understanding of coping strategies used by girls with menstrual problems and the reluctance to access medical treatment. Our study has some limitations that need to be addressed. The present study comprised adolescents with certain demographic criteria, formal education, mainly urban residents, which could be seen as a limitation. Further research with adolescents who have different sociocultural characteristics is needed to generalize the results. Although we did not calculate sample size because it's the first study to be conducted on Egyptian adolescent girls, the large size of our sample probably sufficed to enable a robust analysis of the mentioned outcomes. Additionally, the data could be affected by recall bias, which is common to all questionnaire-based studies. However, people tend to recall experiences that are most relevant to them. Thank you.